Welcome to Sleep Health and this podcast. My name is Dr. Alison Bentley, and this morning we'll be talking about the sleep environment. So where you actually sleep, what you actually sleep on, the temperature, the noise, the bed partners, anything that could affect your sleep that comes from your environment. Now, when we talk about sleep, we just have to track back a little bit to talk about how normal sleep works, because when it comes to temperature, it's really important that we understand that temperature is an integral part of us actually even falling asleep, and that if we don't get our body temperature correct, it's unlikely we're going to get good sleep. So we first look at what do we need to get normal sleep? And in fact, what do we need to actually be able to fall asleep? So how do we fall asleep? And we fall asleep because, number one, we need to be sleepy. Number two, we need to be safe. Number three, we need to be comfortable. And that is really what this podcast is all about, the comfortable part. And then the last one is we need to be able to let go. So I'm going to talk briefly about the other three, and then I'm going to concentrate a bit more about that comfortable one. So first of all, we have to be sleepy. How do we get sleepy? Well, firstly, you need to understand that there are some genetic components to your sleep that you can't really change. One is how many hours of sleep you need to have. Now, I know that Dr. Google and lots of books will say that you have to have 7 to 8 hours of sleep, and that is normal. Well, it's not normal. It's the average. So if you take any population and you ask them how long they sleep, most people will sleep 7 to 8 hours. But there are a significant group of people who need more than 8 hours and a bunch of people who need less than 8 hours. And when I say need, they get 5 hours and they wake up in the morning refreshed, and they are refreshed the whole day and they don't feel sleepy the whole day. This is not the same as people who push their sleep down for 5 hours during the week because of work demands, and then over the weekend catch up by having 8 or 9 hours every day. Those are not the same people. But these people, short sleepers, and only need 5 hours of sleep. And why this is important is if you try to get 8 hours of sleep and you only need 5, you're going to fail. And you're going to end up wanting to try medications, etc., etc. So how do you feel? Why is this important for how you feel sleepy? Is if you need 5 hours of sleep, you need to spend 19 hours awake to push the pressure up to be able to feel sleepy. So, first of all, you need to know how much sleep you need. Then you need to know when you need to sleep, and that's whether you're a lark or an owl. So a lark are people who go to bed really early at 9 o'clock. They're the party poopers. So they are sitting at a party and everyone's enjoying themselves, and they're saying, I have to go back home. It's 9 o'clock. I need to get ready for bed. So they go to bed really early, but they wake up early as well. So they're the 5 a.m. club. They wake up at 5, they go to the gym before work, they do everything that needs to be done. If they're studying, they'll always wake up early in the morning to study. So those are the larks. I have no idea what a lark feels like because I'm a very, very much owl. So the owls are very different. So the owls are the people who keep the party going. So they can stay up very late at night, but then they need to sleep in the morning. So they are very unlikely to be part of the 5 a.m. club. So they usually will sleep from, say, 11 or 12 until 7 in the morning. They will get exactly the right amount of sleep. They will feel well rested when they wake up. It's just a different time. And what's important about this is that if you're a good owl, for example, you can't fall asleep at 9 o'clock because you're not sleepy. So again, you need to know, am I a 9 o'clock kind of sleep person? Am I an 11 o'clock kind of sleep person? Because that will improve your chance of being sleepy. Then, apart from the lark and owl and how long you've been awake for, the big factor that we look at when we talk about being sleepy is melatonin. We all produce melatonin in our heads, called the pineal gland, but it only produces melatonin in dim light. So usually during the day we have lots of light around us, the sun is up, lots of light, but in the evening what should happen is we should have dim light, and then melatonin starts to be produced. Kind of goes up, a nice peak, and then plateaus out for the rest of the night. And when the melatonin goes up, it forces your body temperature down. So that's a direct effect. And when your body temperature is dropping, so in the process of going down, that is when you're going to feel the most sleepy. And so what we try to do is put everything together so it's all in the same spot. So that, let's say you're an owl and you need to go to bed at 11 o'clock, that your melatonin should start being produced at about 9:30 at night, so that an hour and a half later you get that drop in body temperature and you've been up for the maximal time possible. And you put all of those together and it's relatively easy to fall asleep. But it doesn't include the ability of people to fall asleep. So we know, so bringing in that concept really of letting go, we all know people who can be reading, put the book down, fall asleep, and they're sleeping in 5 seconds. We all know those kind of people, and they think they're normal. But there are a lot of people whose head is running a little bit high. And what I mean by that you're just a creative kind of person. You're always thinking of stuff, or you're worrying about stuff, for example, or you're a little bit anxious even about your sleep. And if you find that your head is running a little bit high, it may mean that you need to distract the thinking part of your brain so that the biology can happen and so that you can fall asleep. And these are people who need to read to go to sleep, for example. So if you think about the original thing here was counting sheep. That was the original thing. So distract your brain to thinking about something else so that you can fall asleep. But many people read, many people play on their phones or their iPads, and we'll talk a little bit more about light and how that affects melatonin shortly. But some people do that. Some people meditate. There are lots of different things you can do to distract your brain. Importantly, it mustn't be something that you become energized by. So I used to be able to read to fall asleep. It was my go-to. I would read the same 5 pages that I read yesterday, and then I would be able to fall asleep. But now it doesn't work for me. I get too engaged in the book, and so I tend to just keep reading. So now I play a very boring game on my iPad, turn the light down way down low so it doesn't affect my melatonin, and I only play it for 15 minutes after I've gone to bed. And that helps me disconnect and helps me fall asleep. So all of these things are taken into account when we talk about how do we fall asleep, because that is our job. All our job is to make sure that we're sleepy and fall asleep. The other part of those 4, so we had feel sleepy, be safe, be comfortable, let go. So we've dealt with the feel sleepy, we've dealt with the let go, and then we talk about the be safe. And I don't want to spend too much time on this, but it's fairly obvious is that if you go to bed and you feel that something may happen after you go to sleep, which is traumatic, unpleasant, anything like that, it's very unlikely you're going to be able to relax and fall asleep. So I see this kind of situation in women who are living in abusive relationships, in homeless people. Obviously, they can't sleep because their environment is not safe, anything like that. So you can think of many situations where people would consider that they weren't safe. So once you've got all of that and you've done those 3 things, we're left with this bit in the middle, which is about the comfort, how comfortable you are. Before I get to that, I'm just going to finish the melatonin story so we have that complete. So melatonin forces the body temperature down. Body temperature then stays low for the whole night and comes up again at some time when the melatonin is finished. So you only have a certain amount of melatonin in your brain. When that runs out, your body temperature is going to come up. And when your body temperature comes up, that is your natural wake-up time. So you just naturally wake up at that time. And I think we all know what our natural wake-up time is. So that is because of melatonin. So importantly, what melatonin does is time your sleep, i.e. you will go to sleep here and you will wake up here. That's what it does. But it also does a lot of other stuff in your brain, which is really good for your brain. So it picks up what we call free radical scavenger. So it picks up, bits and pieces of stuff that are just left around after metabolism, after energy is being produced. It picks up that kind of stuff. It appears to clean out the brain at night. So it's a good thing to have melatonin in your brain. As I said, your job is to fall asleep. Once you're asleep, your brain will then take the sleep stages that it needs. Now, those of you who have Fitbits or any kind of other wearable will know that you can get information about your sleep. And the information comes in 4 different pieces. So it talks about the wakefulness, it talks about the REM sleep, and then it will talk about light and deep sleep. Now, the light and deep sleep are what we call non-REM. So you get REM sleep and non-REM sleep. And the difference is during REM sleep, you have rapid eye movements. So your eyes move up and down underneath your eyelids. And in non-REM sleep, you don't have the eye movements. It's fairly straightforward. When you look at the EEGs, there's very big differences between the REM sleep, the light sleep, and the deep sleep. And so any wearable that you use will tell you how many minutes you spent in each of those stages. And as a general rule, what we want to see on average is that about 20% of your night is REM sleep and 20% of your night is the other deep sleep. The functions are slightly different of those two types of deep sleep. So in a very broad sense, what REM sleep does is kind of repair and manage the brain. And what the deep sleep does, the non-REM deep sleep does, is it repairs the body. So it is during that deep sleep, the non-REM deep sleep, that you produce all the growth hormone that you do as an adult. And through the night, that growth hormone filters through the whole system, repairing, getting things ready, fixing stuff that was a bit abused during the day, for example, muscles if you exercised a lot, so that when you wake up in the morning, your brain and your body are ready to go. And so the whole function of sleep is really that. It's to service the car, that is your body, your brain and your body, to service the car so that you're ready to go the next day. Obviously, if you don't service the car, either because you wake up too early or because there is something interfering with your sleep, such as sleep apnea or restless legs, and we've spoken about those in other podcasts, so you have a sleep disorder and you underservice the car, then you're going to wake up tired and you're going to wake up sleepy the next day. And there are long-term consequences to your sleep not being good. That includes cardiac disease, it includes diabetes, and we'll speak a little bit about that when we talk about noise and the impact of noise. So that's kind of the general outline of sleep. That's what we're talking about, just so that when we talk about these things as we go on with the environment, this kind of basic information makes some sense for you. So then let's move on. So we'll start with temperature because it tends to be quite interesting. Temperature is very, very complex. It is not as easy as just saying, oh, we're going to make the temperature of the room this, let's say 25 degrees, and everything will be fine. It's not simple at all. Because when we talk about temperature, we talk about all the ways that we can gain heat and all the ways that we can lose heat. And all of that depends on a set point that we have in the brain. So in the hypothalamus, right in the center of the brain, so the same kind of area that controls our eating, that controls all kinds of other things that we do, is a center for sleep and a center for circadian rhythms as well. So the melatonin is going to act in the hypothalamus. But in that area is also the temperature set point. So the body determines here is the set point of temperature. And as we know, most people, that's 37.4 degrees Celsius. So that's the set point. And then what the body does is try to maintain that temperature at exactly that set point. So whatever the set point has been set, it tries to control the body temperature. So let's look at how you can gain heat. So you can gain heat by metabolic rate. Just the inherent busyness of your body creates heat. You can also increase heat by shivering, so by shaking the muscles. You can increase heat by exercise. You can increase heat by being in the sun. You can increase heat by sitting in front of a heater, by having a hot water bottle. There are all kinds of ways that you can gain heat. There are also all kinds of ways that you can lose heat. So you can lose heat just by breathing out. So we used to measure breathing by breathing in would be cool air and breathing out would be warm air, and we can measure the difference and tell if you were breathing or not. So you breathe out warm air and so you lose heat through breathing or panting, or if you're exercising a lot of hard breathing, you're going to lose a lot of heat that way. You use temperature by sweating, so by putting a small layer of water on the skin from the sweat glands. When that evaporates, the heat goes with it, and so we cool down by sweating. You cool down by having wind, which just blows the air away. So lots and lots of ways that you can lose heat. And so in any situation, so let's say you're exercising and you're producing a lot of heat internally in the body, and the body's kind of going, listen, we can't have that body temperature going up because it's dangerous. We've got to be able to lose more heat, and that is why you're likely to be sweating. It is why you are panting. It is why you love exercising with a fan on. All of those things reduce the amount of heat and get the heat away from the center of the body. The vessels in the skin are very important when you look at controlling temperature. So they will dilate. That means they get bigger if they need to lose heat. And then the heat is very close to the top of the skin. And so the heat can get out of the skin. When you're trying to conserve heat, for example, if you're cold, the vessels will constrict, i.e. they'll get much smaller. And then less blood goes to the skin and more blood stays in the periphery trying to keep it warm. Because if you send blood to the periphery, the blood's going to come back colder. So there are lots of systems. So I'm not expecting you to remember all of that. It's just really important to understand it's not a simple thing of just going, oh, if we do that, then this will happen. Because the body will try to adjust to whatever changes you make. So if you make the room temperature very cold, the body is going to adjust for that, and it's going to try and keep the body temperature high by doing various things. Same thing if the temperature is too hot. Now, the important thing when it comes to sleep is that those changes in the environment and the response of the body to maintain the body temperature may interfere with sleep itself. So let's look. But what I said was there are all of these changes, heat in and out, but then there's also the set point. So the set point is important initially. And when we talk about melatonin and we talk about what melatonin does is it drops the body temperature. What I mean by that is it drops the set point. So it actually moves the set point of the body down, sometimes by a full degree. So let's say 36.5, moves it down to 36.5, and then the body loses heat and tries to get rid of heat to move the temperature down to that level. So various things happen. Our metabolic rate slows down, so we don't produce as much heat. The vessels in our skin get bigger, so we lose heat out of our skin. And our gut isn't active. And so we actually gain heat by eating food because the busyness of the gut creates energy and that creates heat. So because the gut is inactive, we're not producing any more heat either. Now, when it comes to that set point, so a set point drops and it stays low for most of the night, and then the set point comes up in the morning. When we look at temperature during the night, and as I mentioned, we have two different types of sleep, REM sleep and non-REM sleep. During the non-REM sleep, our temperature control, i.e. how good we are at keeping our body temperature at the set point, is very well controlled. So in non-REM, deep sleep and light sleep, good control of temperature. But when it comes to REM sleep, it's not so good. And I was used to say to students that it's like we're a lizard in REM sleep. So if the outside temperature is hot, our body temperature will tend to go up in REM sleep. And if the outside temperature is cold, our body temperature will tend to go down, which it doesn't do in REM sleep. And part of the reason for that is that nothing is well controlled in REM sleep. So if we look at breathing and we look at sleep apnea, people are most likely to have worse sleep apnea during REM sleep than they do during non-REM sleep, because control of breathing is not as good. Control of heart rate is not as good. And most of the wearables that give you that data of deep sleep and REM sleep, the REM sleep they predict as being during a period where your heart rate varies a lot. So during non-REM sleep, it's often very stable. During REM sleep, changes quite a bit, and the variables pick up that heart rate and go, this is probably REM sleep. So it's a good thing because we can pick that up. But if you think about this variability that it's not quite as stable as it should be, both in the cardiac system, in the breathing system, and in the temperature system. So if there are changes in the environment, they're most likely to affect REM sleep, or you're most likely to be woken in REM sleep. So if it's so important that the set point drops, because that is what gives us this big sleepy feeling when we want to go to bed at night, if the drop in temperature is so important, can we manipulate that? So can we, if we don't feel sleepy when we go to bed, can we force ourselves to feel sleepy by changing the body temperature? And obviously lots of people have tried this because it makes a lot of sense. So this is actually how hot baths and showers work before you go to bed. And hot drinks do the same thing. So lots of people will say, I have a hot bath. When I get out of the bath, then I'm super sleepy after that. Well, it's not the heat that makes you sleepy, although that can be a little tiring. It's not the heat necessarily that makes you sleep. It's the fact that you have pushed your body temperature up while you're in the bath. And when you get out of the bath, it cools, and that cooling of the body mimics the drop in body temperature that you have with melatonin, and that's what makes you sleepy. So it's the cooling afterwards that makes you sleepy. So hot baths, showers, hot drinks, that's how we think they work. But there's also been some people who have said, well, let's try taking paracetamol. Let's try taking aspirin. Let's take an anti-inflammatory. Let's see if we can force the body temperature down. And the answer is there's no evidence that works, mainly because all of those are designed to work on an abnormal body temperature. So where the body temperature has been pushed out of normal, such as with a fever. So when you get an infection, all the bacteria release things like cytokines and lots of other compounds. They release these compounds which push the body temperature up artificially. So the set point is pushed up, the body contains heat, so you may very well recognize it when you get flu, for example, that there'll be periods where you are shaking and you can't get warm enough and you've got blankets and tons of blankets. Well, that is the phase where the body temperature has been pushed up and the body's trying to conserve heat to move itself up to that body temperature. If you take a Panado, for example, at that point, then you suddenly go, oh, I'm hot, I'm sweating, way too hot. Well, that's because Panado has pushed the set point down, and now you're trying to lose heat to get down to that temperature. But Panado, anti-inflammatories, Disprin, aspirin, all of those only work on the temperature set point if it is abnormal. If it is normal, which is most people when they go to sleep, it can't push it down any further, so it can't push it into an abnormal range. So that doesn't seem to work. Then, when we talk about the bedroom temperature, can you drop the bedroom temperature and will that force your body temperature to go down? And the answer is no, it won't. As I mentioned previously, so if you drop the room temperature, so let's say you drop it to 20 degrees, which is kind of a little cool, drop it to 20 degrees. Will that force the body temperature down? No, it won't. It will force the body to counteract that low room temperature by pushing the body temperature up to manage that. So again, you will get no vessels showing on the skin, so the temperature will all be pushed into the inside. You might get shivering to increase body heat that's being produced. You're going to kind of close your mouth. You're going to go into a fetal position. You're going to do all of that. And that's going to maintain your body temperature, in a different way, but the room temperature is lower. So, and all of that may actually make it harder to go to sleep. So it's not going to affect the body temperature. The external temperature is not going to push the set point down. So it kind of gets a little complicated, but as long as you remember that there's a set point, and the set point is what the body tries to maintain, and that you get these changes in the set point, but you can't manipulate the set point with outside temperatures. Of course, if you take melatonin as a supplement, you can manipulate the body temperature. So that is about the only thing that can do it. And we do that fairly often in treating people who have insomnia, particularly as you get older. So I mentioned that young people have really good melatonin levels. The best melatonin level you have is probably around the age of 15. And from then on, every night, it's getting a little bit smaller and a little bit smaller. And from about the age of 55, we're pretty confident that most people, the melatonin is less than is necessary to get a good sleep. Now, many people sleep very well over the age of 55 until their 80s because they have a good sleep habit. It's easy for them to fall asleep and they don't need the melatonin to help them fall asleep. But there are a group of people where they do need melatonin, and as their melatonin gets lower and lower, they feel it. It's more difficult to fall asleep. Their sleep is a little poorer quality. It's not terrible, but it's just not great anymore. And so supplementing melatonin at that point in the over 55s, what happens is we are able to produce that nice drop in body temperature, which they've lost from the melatonin, recreate that drop in body temperature so they feel nicely sleepy and it's easy to fall asleep. And then all those good things that I mentioned about melatonin doing in the brain happen during the sleep, and therefore they wake up feeling more rested because the melatonin's done its job. And then some people may need to stay on melatonin after that. And it's really important to not see melatonin as a sleeping tablet. Melatonin, when you take a melatonin tablet, you are replacing the loss of your melatonin. And it's exactly the same situation as if you had too little thyroid hormones, too little cortisol, too little insulin, any of those kind of hormones. If you have too little of them, you replace them. And it's the same thing with melatonin. We are simply replacing something that's been lost. So it's not a sleeping tablet and doesn't have any of the repercussions that you might be concerned about with a sleeping tablet. So melatonin is the only thing that we know of that can artificially drop the body temperature. And you would just take it as a tablet. You don't need a high dose. 2 milligrams is usually fine. In children, if you're going to use melatonin in children, then you need a higher dose because remember their natural melatonin is actually much higher. And obviously melatonin is really useful for something like jet lag. So if you fly east, so let's say you fly from Johannesburg to Perth, that's 6 hours difference. Your day shortens by 6 hours, and now you only have an 18-hour day. And it's really difficult to fall asleep because you haven't been awake enough, long enough, and your melatonin hasn't happened. It's happening in 6 hours' time. And so by replacing the melatonin at the right time for that situation, i.e. in Perth, putting the melatonin in the right place for Perth means that you sleep better a lot faster than if you just let the natural process happen for jet lag. So you can definitely reduce the days of jet lag by taking melatonin in the new time zone. So then let's look at what the contribution is. So there is this tension, if we like, between the bedroom temperature and the bed temperature. So you all know that you go to bed and you kind of create this internal temperature for yourself under the bedding. So we have three components. We have the body in the bed, we have bedding over the top, and we have a mattress underneath. Those are the three components of the bed. And everybody then creates the temperature that they need within that little circumstance. So let's look at the bed first. So most people sleep on a proper mattress. If you sleep on a proper mattress, it's insulated, and so you don't lose heat down through the bed. And it cuts about 20% of your heat loss if you sleep on an insulated mattress. And that's just a foam mattress. It's any kind of mattress that you would buy in a store. Obviously, if you don't have a mattress and you're sleeping on a cold floor, and I think all of us can identify with that, we've done this at least once, slept on the floor and felt how cold it was, that we are colder when we lie on the floor. Some people do that during the recent heat wave we had in Johannesburg. I had multiple people saying to me, I slept on the tiles. They're beautifully cold. And then we lose heat through the body. So it helps us lose heat in hot environments if we're not sleeping on an insulated mattress. Then there are the bedclothes. So the sheets, the duvets, the blankets, and we manipulate those to get the right kind of trapping of heat in this internal environment, or the bed microclimate. Now, and there are pajamas as well. So what you wear. Now, what's really important about this is that there is such a wide range of what is normal for people. Remember that there's a range of metabolic rates. So I'm sure you know people that when you touch their arms, they're always cool, and other people that when you touch their arms, they're warm. And that's a difference in metabolic rate. Now, if you have a high metabolic rate internally, so your kind of engines are running, you don't need a lot of bedclothes. You don't need a lot of pajamas to keep the temperature the way that you like it. But if your body temperature is low, or your metabolic rate is low, it's much harder to create the heat. And that situation affects most women after menopause, when your metabolic rate drops a little bit. So for example, and I'll just give you a personal example. So my husband and I in the same bed in winter, he has winter pajamas. He might have a beanie because he's going a bit bald, and he'll have one duvet and one sheet on his side of the bed. On my side of the bed, I have often 2 pairs of socks, winter pajamas, vest, scarf, and a hot water bottle, and an extra blanket on my side of the bed. Why? Because that's how much bedding I need to be able to trap what little heat I'm producing. The hot water bottle has been a game changer for me, because I can lie in bed and just go, I cannot be warm. I just cannot create this warmth. But just with a hot water bottle, honestly, just before I go to bed, I only sleep with it all night long. Just before I go to bed, just to warm that bed up so that I can warm up and be warm enough to fall asleep, makes the difference. So there isn't a normal. It isn't normal to only sleep in a t-shirt and shorts. It isn't normal to sleep in full winter pajamas. It is just a personal preference. It is what you need to do to create that microclimate. Now, the range of that microclimate, the temperature that has been assessed research-wise, is to what is that temperature that people create in that little bed, in a little triangle between the bedding, the mattress, and you in the middle of that, ranges between 26 degrees Celsius and 36 degrees Celsius. In Fahrenheit, that's 79 to 97. So 26 to 36 Celsius, 79 to 97 Fahrenheit. That's a huge range. And that's because people are different. People need different things. So important to understand that you can't then say, oh, the bedroom temperature has to be this for everybody, because it just doesn't. people will adapt how they're sleeping, what they're using to sleep with, whether they add a scarf and a beanie, whether they add another blanket. They will adapt that to counter the room temperature. Second problem with the room temperature is that in many countries in the world, the US, Europe, for example, room temperature is maintained constant because they have central heating, they have air conditioning, and that maintains room temperature at the same temperature day and night, winter and summer. In South Africa and the majority of the world who cannot afford those kinds of luxuries, the room temperature is going to vary depending on the outside temperature. So in Johannesburg, our outside temperature can vary from -2 degrees Celsius up to 35. It's quite a big range, and your room temperature is then likely to range depending on that outside temperature. We don't have double glazing in our windows. We don't prepare. We may have pink fluff in the roof, and that keeps the room cool to avoid the temperature. But that range in outside temperature is actually really important for the room temperatures in many situations, the majority of the world who cannot control this. So think about, for example, a miner who works in the diamond mines up in Messina. So Messina in South Africa, really close, much closer to the equator, much, much hotter, gets up to 36, 37 degrees, who works a night shift on the mine, comes home to a corrugated iron shack and has to sleep in 36 degrees temperature. It's really, really hard to do that. So it's really important for us not to just talk about people in nice houses, each with a single bed, each with aircon, because that is really luxuries that most people don't have in the world. Again, what else do we do about the climate in our bed? So when we're cold, we lie still. We don't move, because if we can create that little air bubble, warm air bubble around us, we don't want to change it. And if we move, we tend to move that warm air, and cold air tends to come in. What's interesting, what I didn't know before I did research for this particular session, is that there is a unit of measure for bedclothes as to how good they are at trapping heat. And that unit of measure, and apparently is used for clothes as well, and that unit of measure is called togs. So they measure it in togs. So for example, a winter duvet would be 9 togs, i.e. very good at trapping heat, and a summer duvet would be 3 togs. So there really is quite a lot of research ongoing as to how we maintain this internal temperature, given that the outside temperature may change quite a lot. So for us, when it gets hot in summer, we tend to wear less pajamas, throw off the duvets, only have a light sheet and have a fan on. And in winter, we'll pack all the blankets we have in the house on the bed. So we tend to adjust our microclimate, so in our bed, because we often don't have control over the room temperature. So how do people who are in hot climates anyway, so people who live on the equator, so particularly equatorial Africa, Asia, where the temperatures are hot all the time, how do they cope? Well, for various ways. So remember I said that you can lose 20% of your heat through the back, i.e. through the mattress, if you don't have an insulated mattress. Well, that's why they sleep in hammocks. That's why they sleep on grass mats. That's why they sleep on the floor or on the roof, so that heat is lost through your back if you're lying on your back. So you can lose a lot more heat. They will use a fan to increase movement of air. They'll open all the doors and windows so that there's movement of whatever air there is. And then they have a concept called a sleeping cloth. So often you will see people in very hot climates sleeping wrapped up completely in a cloth. And your sense would be like, doesn't that make you hotter? Doesn't it trap the heat in? Well, no, because what happens is it gets wet. And then when it's wet, then you lose a lot more heat through that water because the insulation has gone. You lose heat. There's evaporation of the water, and so you lose heat again. And so in a wet sleeping cloth, you tend to lose more heat than in any other kind of circumstance. So that actually works out quite well. All of this conversation about external climates and how we deal with that is very important in the context of global warming, of climate change. And there are quite a few papers now coming out about the response of our sleep to changes in climate. And overall, what they're showing is that as global temperatures rise, our sleep quality is getting worse. So just as a really general thing, we're not sleeping as good as we used to sleep because temperatures are going up. And there's a limit to how much we can lose our body temperature. And once our body temperature is high, then we're going to have difficulty sleeping. So what do high and low temperatures actually do to our sleep? Well, firstly, they make the total sleep time get lower, so you sleep less hours. You reduce the amount of deep sleep, so the non-REM deep sleep, and you reduce the amount of REM sleep, and it's harder to fall asleep. So everything goes wrong, essentially. So you're there in a hot environment and a cold environment. Both environments do the same thing. So you're in that very hot or cold environment. It's much harder to fall asleep. You sleep less hours, and within that sleep, the sleep changes, so you get less deep sleep and less REM sleep. So basically, you don't sleep well. That's how that works. So you're going to wake up tired, and you're going to know that you're tired the whole day. All right. So that's temperature. It's complicated. It's very complicated. It's not as easy as saying this is the temperature you need to have the room at. So let's talk a bit about noise, sleep and noise. And usually when we talk about noise, we're talking about traffic noise. And that's cars, trucks, trains, aircraft, any kind of noise. There's no question that noise is a problem for sleep. So when you're exposed to noise during sleep, obviously depending on how loud the noise is, but when you're exposed to noise, it's during sleep, we know that you increase the levels of adrenaline and cortisol. Those are awake hormones, so they shouldn't be there when you're asleep. You increase the heart rate, you increase the blood pressure, and most people don't know that's happened. So it's just there's a kind of little responses that are happening when you're asleep. Most people don't know they've happened, but they do know, people who sleep in environments routinely where there's a lot of noise do know that if they go and sleep in a low noise environment, they know they are sleeping better. So they know that there's a difference between the high noise and the low noise. And there is now good evidence that people who sleep in high noise environments all the time, because of these little bursts of adrenaline, little bursts of cortisol and heart rate and blood pressure, that is identical to the responses that we get with sleep apnea and all of the other big sleep disorders. And so because it looks the same and because it's the same kind of response of the body, now long exposure to noise at night leads to the same effects, and that is increased cardiac disease, increased metabolic disease, increased obesity, increased depression, etc., etc., all of those consequences. So living in a noisy environment is not something to just ignore. And if possible, you should always try to have earplugs. If you have to sleep in a noisy environment, don't say, oh, well, I can sleep, it's fine. You don't know what's happening during your sleep, and during your sleep is being affected. So please wear earplugs if you do live in a noisy environment, if you can. So that's noise. The last thing is bed partners, to sleep in bed partners. How many bed partners should you have? And the answer is as few as possible. There's no question that people sleep better on their own, but that is a relatively recent thing that people sleep in their own beds. It's for many, many millennia, probably everybody slept in the same bed, obviously because of warmth and because of security. Like it just makes sense that everyone's in the same room, in the same bed, because you can be warmer. And the majority of the world has a communal bed. Again, it's about economics. The majority of the world cannot buy a wonderful, comfy bed like maybe you can buy. So they don't have the money to buy the bed. And so if they do buy a bed, then as many people as possible sleep on that bed because there is only one bed. Often their houses that they have don't have enough space for more than one bed. They don't have more than one room. So everyone has to be in the same room. And so we need to move away from, again, this concept that it is normal for everybody to have their own bed and everyone to be in their own room. That choice is an economic choice. It's not a normality thing. Far more people sleep in communal situations than in single beds around the world. And in fact, the communal bed, as I said, was known for many, many years. And in fact, it was during the Victorian times. So we're talking about the early 1900s, that kind of time, which is millennia after people were around. It's only then when the Victorians, who are known for their prudishness and they're like wanting to keep everything secret and not having this and not being able to see ladies' legs, etc., that's when people started sleeping in single beds. So it was for hygiene reasons and it was for privacy reasons that people started sleeping in single beds. And importantly, neither is normal. It is just about your situation. That's what you do. So what about bed partners? Let's start with the human kind of partners. Now, it is usual that it is a female-male partner. There is no literature on any other kind of partnership, so we're going to just stick with the female-male partners. And what's clear in the literature is that men move more than women do at night. So all of those women who are complaining about their men moving a lot, you're right, they do. Just as a species, men move more than women do at night, and women are much more likely to complain about being disturbed by movement from their partner. If we take women and look at their sleep when they sleep with their partner and then take them to another bed on their own, they sleep better, so their sleep looks better, but they prefer sleeping with their partner, and that's usually about the relationship or about security, not necessarily about the sleep itself. So they will recognize their sleep is better. They still prefer sleeping with a partner. It's a much bigger problem if one of the bed partners has a sleep problem. So the first sleep problem we're going to look at is if one of them has insomnia. Now, if you have insomnia, and we've spoken about this in other podcasts, if you have insomnia, you're really worried about your ability to fall asleep, particularly if you wake up in the middle of the night. It can be harder to fall asleep. And if something happens while you're trying to fall asleep, such as a noise, you kind of alert, and it makes you more worried about the fact that you're going to fall asleep. And what happens over time is that there's quite a lot of distress about noise or movement in the bed, that's going to interfere with you falling asleep. It can get very severe. I have some patients who live in apartments who switch off the fridge at night because they feel that noise prevents them from falling asleep. Now, there's no question that the response to the noise in patients who have insomnia is out of proportion to the actual noise. There's a huge amount of distress, and patients will talk about the rage that they feel when there's a noise because now they can't sleep. So understanding that part of the process of insomnia is this anxiety, is this concern, is this inability to switch off, is a whole lot of thinking that happens around sleep, which is not normal. But when that is aggravated by any kind of noise, then that makes the whole situation a lot worse. So if you have insomnia and your bed partner snores once, that's going to freak you out, and you're going to kind of want your bed partner in another room. And insomnia and snoring, for example, as a combo, a very bad combo. But if you have that combo, it often affects the relationship itself, in that the female partner, let's say the female has insomnia and the male has snoring, is that the female partner will feel that the male isn't doing anything about the snoring. And the male's kind of go, I cannot do anything about the snoring. It happens when I'm asleep. I don't even know I'm doing it. So it can cause some friction in the relationship as well. More concerning is that if we look at women and insomnia, their insomnia or their sleep starts to get a lot worse after menopause, so starts to get a bit more fragile after 50, and men on the other side start to snore more when they're 50, and so it's a very bad combination to have a woman post-menopause whose sleep is quite fragile, and then a man post-50 who is snoring because maybe he's put on weight, for example, or he always was a snorer. So often you'll have partners or marriages where everything's been fine for 20-odd years, man has been snoring, but woman's been able to sleep quite well, and then woman has some change in their sleep, for example, just going through menopause, and the snoring is consistent, but now it's a problem, and it never was a problem before, and that's because the woman's sleep is worse. And whenever I'm seeing patients who come in to see me for snoring, we will have a conversation about the bed partner. What is the bed partner's sleep like? And they will often say, no, it's not great. And I'm going, well, please understand there are two people in this relationship. Yes, you snore, and we're going to try and solve that. But maybe if we make your partner's sleep better, then the snoring won't be as disruptive, and we may be able to come to a compromise. So snoring and sleep apnea, the most annoying thing about snoring and sleep apnea is snorers do not wake themselves up with the noise. They do not hear the noise. They have no idea how loud they are. One of the funniest things we get in the sleep clinic is when we have two snorers in overnight to have a test for sleep apnea, And the one snorer complains about the other snorer the next morning about how bad the snoring was. But the other snorer complains about them, about how bad their snoring was. And they're both kind of going, really? I snore that badly? And they go, yeah. Both of them are saying, yeah, you're terrible. And because you don't know, if you don't have a bed partner, if you don't have children who are going, Dad, I can hear you down the passage snoring, you don't know that you snore. And that's the most frustrating thing. While we're talking about bed partners, yes, if you're snoring and you have sleep apnea, you should definitely have something done about that. But women who are sleeping with bed partners who snore or have sleep apnea have worse sleep. So they are affected by the noise. Their sleep is fragmented. They don't sleep as well. And some studies have shown, in fact, that they present in the mornings with generalized muscle pain as if they have flu. So kind of a fibromyalgia kind of pain, that they just have this pain because of sleeping with somebody who has sleep apnea. And when we take men who are snoring and we do the study and we find out that they have bad sleep apnea and we put them on CPAP, which I'll remind you is that machine which pushes air down through your nose and holds your throat open so you don't snore and you don't stop breathing. So when we put them on CPAP, every single male will say to me, what's the noise of the machine? And will my wife be able to sleep with the machine noise? And I always turn to them and I go, you mean compared to the snoring? Like, there's no comparison. Your snoring is terrible, and this is one machine. It's less than an aircon. So, and again, we do have data now to show that partners of people with sleep apnea sleep much better when their partner is on CPAP. So that takes away the snoring, it takes away the apnea, and the partners can sleep a whole lot better. So if you have snoring and sleep apnea, please get it fixed. Please go on CPAP. Your wife or your husband or your bed partner will thank you for that because they will sleep better. The last bit we're going to talk about bed partners is the furry friends. Again, this is not new. Literature tells us that Alexander the Great slept with his mastiff, slept with his dog on the battlefield. And if you're on a battlefield, understand you have no bed, you have no blankets, you might have one blanket, but having a dog or having a horse that you can snuggle up to help with the heat gain and as them as a hot water bottle can be very useful. In fact, the Aborigines had an expression which was called three-dog night. And some of you who are as old as I am may recognize that as a band that was around in the 60s and 70s. Well, the expression three-dog night comes from, that's how many dogs you need to keep you warm that night. So, that night was a three-dog night. Tonight might only be a two-dog night, but that was a three-dog night, which indicated that it was really quite cold. And the data would tell us that 50% of pet owners sleep with their pets on their bed. That's quite a much higher number than I thought it would be. So 50% sleep like that. And sometimes people sleep better and sometimes people sleep worse. Now you understand, I don't care how your dogs and cats sleep. That is not my problem. They can catch up during the day. I care about how people sleep. So we're talking about people sleeping better or worse. People sleep worse because dogs and cats don't sleep like us. We have what's called a monophasic sleep. We sleep once a day for a long period of time. Within that period, dogs are going to have 3 or 4 phases of sleep. So, dogs sleep during the day and they sleep here and they sleep there. They kind of sleep whenever they want to. Cats often sleep in the late afternoon and then often are awake at night. And I'm sure you've seen videos of cats running around the bedroom while people are trying to sleep. Because they sleep differently to us, they often disturb sleep. So they move a lot and they can disturb your sleep. So that's when you're going to sleep worse. You're going to sleep better if your dog, particularly your dog, sleeps with you and you have a sense of security in that you've got a better alarm system, or because they help warm you up, then you're going to sleep better. But overall, it's a kind of trade-off. I'm always fascinated by the fact that I will have patients with insomnia and we always talk about who else is in your bed. And they'll say, I have my 4 Yorkies in my bed and they disturb me a bit, but shame. And I go, no, really, your sleep is more important than them. They can sleep elsewhere. You need to be able to sleep. And if they're disturbing your sleep, we need to take them off your bed. And it's quite an interesting war that then goes on between me and the patient. And the patient determined that their dogs are more important than their insomnia. So it's quite it's an interesting and really frustrating thing for me to have to deal with. So when it comes overall in general, what do we do about our sleep environment? It's a very personal choice. If you can manipulate your room temperature, manipulate it, put it at the temperature that you want. If, as far as your internal bed climate is concerned, it has to be a climate that you can fall asleep in. So it's got to be warm enough for you or cool enough for you to be able to fall asleep in. So I cannot give you any global advice about what the room temperature should be and what the bed temperature should be. But if you can't manipulate your temperature, then you need to manipulate your bed environment to manage a higher temperature. All the research literature tells us that temperatures are going to continue to get higher globally. And so you need to have a way to manage that if you can. So that's for body temperature. For noise, if you are in a high noise environment, please get some earplugs because there are long-term consequences to noise pollution if your sleep is disrupted. And then for bed partners, the rule is as few bed partners as possible. And lastly, when it comes to your bed, I'm not the expert when it comes to beds. I have only one comment about beds. They have to be comfortable for you. It is not true that everyone needs a hard bed. I cannot sleep on a hard bed because I'm a side sleeper. So if you sleep on your back, a hard bed works fine for you. But if you're a side sleeper like I am, I wake up with sore hips because they're on that hard mattress. So I sleep on a soft mattress. Really importantly, to get a mattress that's comfortable for you. Difficulty is if you need a soft mattress and your partner needs a hard one. That's a little tricky. But single beds, the same size as a king size bed, that's what you do. There are various ways of doing this. But what I would urge you as far as a bed is concerned is please go and speak to somebody who knows about beds. Try them out. And when I say try them out, I have been told you may not do the butt test. And the butt test is you just sit on the bed. Lie on the bed. Lie in the position that you usually lie. Is it comfortable? Can I turn over adequately? If my partner moves a lot, put them on the bed as well. If they move, can I feel that movement? It's really do some research, and I mean try the beds on the bed before you buy it, because again, it's a personal choice. You need to be comfortable with the bed that you have. I hope that was useful. It's not something we talk about in medicine very often, but it's questions that I get asked by patients all the time, and I really feel that it's often an adequate response to them. So I hope it was useful. Thank you so much for listening.
You've been listening to another production from Solid Gold Podcasts.